Submitted in support of Resolution 201 over the past 2 months and eventually led to the introduction of Bill 215 last Friday. However, one group has since come out opposing the measure.
The Guam Medical Association appreciates the intent of the bill and appreciates that it is to benefit and help patients. However, we have yet to come up with a support of the bill and would like to have a bigger conversation before the bill comes to fruition.
GMA spokesperson Dr. Erica Alford says Bill 215 no doubt will start the conversation. However, the concern stems from the fact that GMA's opinion was not obtained on this matter.
The big part is we don't want patients to think that medical marijuana will be the cure-all or a good treatment for all their conditions.
According to a release over the weekend, GMA states that the diagnosis and treatment of diseases should be left to trained medical professionals and not be legislated, especially when we are requiring physicians prescribing authority. Alford says, for instance, glaucoma, one of the debilitating medical conditions listed in the measure, may not necessarily provide better treatment than what is offered in the market already.
Studies are showing that smoking 2 marijuana cigarettes a month do not increase risk of lung cancer, but if you're smoking on a daily basis as treatment, yes, it may.
But it's not just the health concerns that has GMA concerned. It's several other gaps Alford says the bill does not address, another of which includes regulation and control.
If you have multiple medical problems for which you feel you need marijuana, you're probably on multiple medications already. Do we know what the interactions are? The other issue is if there's no control on how it's manufactured and processed, then we can't say for sure that it's safe.
Bill 215 does establish an advisory board aimed at coming up with the rules and regulations, but Alford says, again, that's another concern as well, considering the island only has 1 neurologist along with 2 infectious disease specialists.
So our specialists are very limited and they're very stretched thin, so I think that will have to be seen if whether an advisory board such as this can be put together. It would be difficult.
Alford says because marijuana is a controlled 1 substance, it makes it even more difficult for the medical professionals to do more research. She does, however, acknowledge that there are several holes in our medical system, and we need to do more to help our community, especially with our limited resources. She adds there are alternatives to medicinal marijuana, such as Marinol, a drug that helps treat or prevents nausea and vomiting caused by cancer medicines. The bill's author, Senator Tina Mooney Barnes, meanwhile, says she has wanted feedback from the medical community, including GMA, since the beginning, but did not even receive any testimony from them for Resolution 201. Barnes says she even attended a Rotary debate on the topic where GMA President Dr. Thomas Shea spoke against legalizing marijuana on Guam.
I don't want to fight with the medical association or the medical society.
Nonetheless, Barnes says she invites any kind of feedback on the measure and hopes to have a public hearing soon.
And this is the step that we're taking to move forward. So if GMA wants to share their concern or their support, more importantly, their support for medicinal uses of marijuana, then I invite all of that.
Alford, meanwhile, says the GMA board is meeting this week to come up with a final stance on Bill 215, which may even include some of its ideas they may want to include in the measure. Reporting for Guam's News Network, I'm Ken Kinson.